Good afternoon. How are you?
I'm good. Thanks. How are you?
I'm very well, thank you. What is your name, surname, and where are you from?
My name is Sonwabo. My surname is Tshandu. I'm born and bred in Colesberg. I'm from Colesberg.
How did you hear about Partners in Sexual Health?
I first learned from the media on the adverts that are coming out from the media, and I also learned that we have partners in sexual health locally as one of the partners of the Department of Health.
Which problem did you experience before your interaction with Partners in Sexual Health?
We have a problem with STIs in the society and teenage pregnancy.
How did your life change after your interaction with PSH's health promoters? Were their information and services able to solve your problem?
Yeah, their interventions assisted in reaching out our patients because they are community based, so they reach out to their communities. It actually helps us now to dig more because we were actually treating symptoms mostly, but now we're dealing with the problem, the core of the problem, because there are foot soldiers that are reaching out to everybody in the society out there. It makes it easy even to market the program of HIV with PrEP, to curb the spread of the disease. It's actually broader than we think, because our society is beginning to see the light.
PSH's Common Good Youth SRHR project is funded by the Social Employment Fund. Is this a project you would like to see continuing in your community, and why?
Yes, definitely would like to see it continuing, because already we can see the impact. There is a positivity mindset that is coming up, in particular with the youth, looking at their sexual health in a different perspective, not to be people that are reactive, but people that are proactive and taking the stance in promoting their good health in the society. It's a project that is needed in our society, because Colesberg is a small place. It takes time for information to reach out, and with the presence of the foot soldiers of PSH, it's actually becoming easier and easier. People learn from the media and they also hear from them. It makes a difference now because they can interact with them face on and make life easier. And referrals are coming through. People will tell you that I'm coming to test because I met the people from PSH, they went to my place, I met them in the street or wherever, because they are all over. Then they actually really come and make follow-ups, and they are testing for either HIV or looking after their status in terms of the transmitted infections, including the teenage pregnancy that is a rife problem. The other thing that is also, they are also assisting with, you would be aware of the drug and substance abuse that is rife in our society. Their interventions are also reaching out on that, because when they talk about sexual health, they also talk about drug and substance abuse, and most of the cases are spreading because there is a lot of drug and substance abuse. It also assists in kind of alleviating the problem, if not even diagnosing the problem, because sometimes we get cases that are already being started. Yeah, it's a project that I would wish for it to continue, and not just to continue, or rather to, in a way, be expanded.
Yes.
To have more assisting basis. Like for instance, if you would have direct referrals and dealing with those problems that are coming from the society as BA stage,
Yes.
than referring. Sometimes it's good to refer, but what happens after referring? That is what is important. Because the aim for referral is actually to see for change happening and being maintained like that. And if it does not happen, then it becomes a problem. It says you referred, but follow-up was not so actually good. Yeah, I would like it to be expanded. Keep it, rather expand it to, but don't end it.
Well, Mr. Tshandu, thank you so much for sharing your stories of change.